Good day to all. I am Dr. Maria A. Gorelick, Medical Director at Henderson Behavioral Health. Henderson has been offering mental health services in Florida since 1953. During the COVID pandemic, we have continued offering services and advice about how to cope during these extraordinary times. Even though the main focus and attention was given to the medical aspect of the pandemic, we now know the effect it has had on mental health. And now there's a high prevalence of mental disorders as a consequence of the COVID-19. Some data shows that about 80% of people have had some moderate to serious mental issues such as depression, anxiety, substance abuse, and in children and adolescents, similar conditions added to behavioral problems. Young adults seems to be more susceptible to experiencing mental distress. Meanwhile, adults 60 and older had smaller increases in severity. Adults between the ages of 25 to 59 years were more likely to lose their jobs due to the closing of restaurants, gyms, stores, public places in general, and this has caused an experiencing an increased financial burden. In the 18 to 25 year age group, depression and anxiety increased as they spent less time interacting with others and in person, and in doing activities outside. Regarding the younger population, parents experience more stress in having the children home due to the closing of schools and daycares. They have to juggle between working from home and caring for the children and the home in general. So in general, staying home has been a challenge for everyone, causing a sensation of social distancing away from family, friends, and also causing a limitation in the amount of activities that we can have in our daily lives. There have been more calls to the mental health hotlines and more visits to the mental health care providers. They have been seen via telehealth due to an increase in mental health symptoms. Here at Henderson Behavioral Health, we would like to let you know that our doors have remained open for services. We are strictly following the CDC guidelines for prevention and protection from COVID-19 infection. Our psychiatrists, nurse practitioners, therapists, and case managers, as well as our general nursing staff, are seeing clients via telehealth or in person by using a mask, keeping social distancing, and applying frequent hand washing or using sanitizers as needed. We also have personal protective equipment, which is used in cases that require so. Some of our providers are working by using telehealth technology, and this has made it very easy and convenient for some clients to be seen as frequently as necessary without having to come to the clinics. Our centralized receiving facility located at North State Road 7 is open 24 hours, 7 days a week, offering different kinds of services such as psychiatric evaluations, case management, and placement assistance as available, and referrals to an inpatient treatment facility if necessary. We also have a crisis stabilization unit that is also open 24 hours, 7 days a week, working closely with our local hospitals. Our outpatient services are offering psychiatric and psychotherapeutic treatment, as well as case management for children, adolescents, and adults in need of treatment. For more details, please visit our website so you could see all the programs that are offered. Now, I would like to give you a few tips on how to cope with COVID-19 or any other stressful situations in your life. Even though you may need to have social isolation from others, This does not mean that you have to stay disconnected. Therefore, maintain social connectedness with others by using different platforms that are available other than your phone. Use FaceTime, WhatsApp, Skype, even Zoom and Facebook. Limit exposure to the media, as the news may be increasing anxiety and fear in you. Just listen enough to stay focused and informed. Keep a daily routine. Wake up at the same time and have several activities planned ahead, even if you're home. Be aware of your thoughts. Do not allow fear and pessimism to overtake you. Do relaxation and breathing exercises and meditate often. Using techniques of mindfulness meditation, you will learn to connect with your higher self, away from negative thoughts and feelings. There are plenty of meditations and relaxation exercises on YouTube and the internet in general. Explore it and see which one feels right for you. Stay active and distracted. House. If you're capable of riding a bike, go ahead. Jog, exercise from home. Cook, read a nice book, sing, dance, attend to your garden if you have one. Being in touch with nature is one of the most rewarding things we can do for ourselves. You can also distract yourself with opposite emotions. For example, do things that make you happy, relax, and laugh when you feel down or stressed. Distract yourself with situations. For example, take a cold and a hot shower. Squeeze your hands strong and hard. Clap. Do jumping jacks. Maintain a healthy sleep routine. Try to wake up at the same time every day. Avoid caffeine in any way, tea, coffee, beverages. Don't sleep in the seat, in the sofa, or in a chair. Just make sure that you go to bed at night when you're ready to fall asleep. Do not watch TV or read on your bed. Eat healthy, especially foods which can make your immune system stronger, such as citrus fruits, berries, green leafy vegetables. Chicken soup is very good. Garlic, peppers, and make sure you take your multivitamins and minerals every day. Stay out in the sun 15 to 20 minutes in the morning and in the afternoon when the sun does not feel so hot on your skin. Hydrate yourself with at least 10 glasses of 8 ounces of water every day. Avoid alcohol, drugs, and tobacco. Now we're going to look at some ways of keeping your breathing cycle stable and healthy. Learn to breathe appropriately. This technique I'm going to give you takes a couple of minutes. You're going to find a way to sit in a comfortable position with your hands on your lap. You're going to exhale all the air from your lungs, and you're going to gently inhale through your nose to a slow count of 4 or 5. Hold at the top of the breath to a count of 4. Gently exhale through your nose, also at the count of 4. At the bottom of the breath, pause and hold to the count of 4. And then you start your cycle again. Breathing this way for about 5 minutes will keep you healthy, will regulate the level of oxygen and carbon dioxide, and it will make you feel invigorated and full of energy. As I mentioned before, it is our purpose to offer you support, assistance, and treatment during these challenging times. I invite you to visit our website at www.hendersonbh.org. We are a nonprofit organization where our mission statement makes it clear that our goals are to pursue and offer motivation, compassion, and hope to everyone who walks through our doors. Stay safe and healthy. Thank you.